Hey, my name is Ify. I'm a nurse practitioner student from Brandman University. I'm here to assess my patient, Emeka. From observation, Emeka has good posture. He's not in any physical distress. He's well nourished. He's a little bit overweight. Um, he's dressed appropriately for the weather. And I'm going to talk to him, introduce myself, and what I'm going to do. I'm going to then get his vital signs, which includes his temperature, pulse, respiration, O2 sat, height, weight, and BMI. And they were all appropriate for his height and weight. Emeka, hi, my name is Ify. I'm here to assess you. Do you know why you're here?
I'm here for sports physical.
Good. I'm going to do a comprehensive assessment. I'm going to ask you questions and I'm going to examine you. If you start feeling any pain or discomfort or need to go to the bathroom, let me know. Okay?
Okay.
Good. I'm going to start the exam. So I'm going to assess his face. His face, his eyes, and the brows are all symmetrical. His ears are symmetrical and positioned on the same side. On the center of his face, he has a scar. How do you get the scar?
My cat scratched.
Your cat scratched you. Okay, be careful when you play with your scratch.
Okay.
So I'm going to assess his hair. He has good distribution, very thick distribution of hair, and there's no balding, and I don't see any infestation. So I'm going to palpate his scalp. Do you feel any pain or tenderness?
No.
So his scalp is freely movable, and there's no bump or sign of bruises. Okay. So next, I'm going to palpate his face. Do you feel any pain when I'm touching your face?
No.
Good. So the next I'm going to do is to start his eye I'm going to palpate his sinuses. Okay. Frontal sinuses. Do you feel pain?
No.
I'm going to palpate his maxillary sinuses. Any pain?
No.
Edmondo, any pain?
No.
So, Emeka, can you smile? Puff out your cheek. Tight your eyes shut. Okay, good. Facial movements were symmetrical and his 7 cranial nerves are intact. Then next, I'm going to palpate his TMJ and assess for 5th cranial nerve. Emeka, open your jaw, bite down, move your jaw side to side. Good. He has full range of motion on his temporomandibular joints and the 5th cranial nerve is intact. Okay. I'm going to check for sensation on his face. Tell me, close your eyes. Tell me if anything touches your face.
No. 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 No.
So he has good sensation on his face. His 5th cranial nerve is intact. I'm going to move to looking at his eyes. So I'm going to start with his eye. Close your eyes. His eyelids were able to fully close. His eyebrows are symmetrical. There's no discharge. Open your eyes. There's no discharge. There's no edema. There's no redness. There's no ptosis when he opened his eyes. They open evenly. So I'm going to look at your conjunctiva. Please look up. There is no jaundice on his conjunctiva, both the upper and okay. His sclera is white. There is no evidence of any trauma or infection. So I'm going to look into your eyes and check for the red reflex. Okay. Great bilateral red reflexes. So I'm going to assess his vision. Can you read the last line?
LTFPH.
Good. He has 20/20 vision without corrective lenses. His cranial nerve number 2 is intact. Now I'm going to assess his pupil reaction to direct and consensual light, and also assess for accommodation. Look over my shoulder. Good reaction to light. I'm going to assess consensual reaction. Good pupillary reaction. Now I'm going to check for accommodation. Look over my shoulder. Patient has good accommodation. Next, I'm going to check the extraocular movement, which is the fourth, fifth, the third, fifth, and sixth intracranial nerves. Now, follow my finger with your eyes. Don't move your head. Good. So cranial nerve 3, 5, and 6 are intact. Good. So I'm going to look at your ears. So both ears are symmetry, and I'm palpating the ear. There is no lesion, there is no swelling on the pinna. Look, I'm going to okay, I'm going to look into your ears, okay? Okay. Good. The left auditory meatus is patent, and the eardrum is intact, pearly gray. There's no sign of drainage. There's no sign of blockage. There's no sign of infection. So, good. So the right ear is this. The right ear canal is patent. The eardrum is pearly gray and intact. There is no signs of infection or no any sign of drainage. Now, Emeka, I'm going to hit this and tell me if you can hear it on both ears at the same time. Can you hear it on both ears at the same time? Yes. Okay, I'm going to do this and put it on the back of your bone. Tell me if when you stop hearing it, okay?
No. No.
Good. Air conduction is longer than bone conduction.
No. No.
Good. So the number 8 cranial nerve is intact. So what else? So now I'm going to look into your ears. No, into your nose, okay? Okay. Good. So the both nose are patent, and there's no congestion. The nasal mucosa are pink, moist. The turbinates are pink and moist. There was no discharge. There is no evidence of swelling. There's no evidence of septal deviation. The septum is at the middle. So, can I get a spoon? So, the next I'm going to do is I'm going to look inside your mouth, okay? Can you open your mouth? So, patient has good dentition and good oral hygiene. There is no foul smell. There is no evidence of ulcerations on the nasal mucosa, and there is no evidence of dental caries. Now, I need you to open your mouth again. Say, ah, ah. Good. I'm going to open your mouth again. I'm going to test for gag reflex. Good. So the gag reflex is intact. Can you move your tongue left, right, up, down? Good. So his 9th and 10th cranial nerves are intact. He has good gag reflex. His tonsils are +1, pink and moist. There is no signs of infection. There is no signs of swelling. His uvula is in the middle, and there is no sign of swelling or any infection. So the next thing I'm going to check is his 11th and 12th cranial nerve. So now, move your head against my hand. Good, very strong movement. Move your hand against my hand. Good. Shrug your shoulder. Shrug your shoulder. Keep shrugging. Good. So his cranial nerve 11 and 12 are intact. The next thing I'm going to do is I'm going to move on to respiratory and cardiovascular assessments. So I will start with assessing the neck. Can you lift up your neck? Okay. I'm going to assess the motion on the neck. Can you move your head back and touch your chin? Touch your head on your chest. So patient has good range of motion on the neck, and it's okay. Just by looking at the neck, the trachea, I don't see any rash, I don't see any darkening, and the trachea is centrally situated. I'm going to assess the thyroid gland. Good. The thyroid gland are smooth. There is no signs of nodule. I'm going to palpate for the carotid arteries. The carotid arteries, the carotid artery is full and it's +2. Okay. I'm going to listen to the carotid arteries as well. There is no bruit on the left carotid artery. I'm going to listen on the right carotid artery. Put your head straight. There is no bruit on the right carotid artery. Now I'm going to palpate for nodules. Okay. Okay. There is no enlarged lymph nodes. I'm going to listen to his thyroid for bruits. Okay. There's no bruits over the thyroid. No. I'm going to assess his chest. Okay? Good. And go there. Let me assess the apex. Do you have any joint pains?
No.
Do you have any joint pains?
No.
Let me look at your fingers. The skin on the arms are smooth. There is no rash. There is no pain. The nails did not show any signs of jaundice, pallor, or clubbing. And I'm going to check for capillary refill. The capillary refill is less than 3 seconds. I'm going to check for popliteal pulses. No. The brachial pulses are +2. I'm going to check for radial pulses. Good radial pulses +2. And can you turn this way? So come close. Get up, get up. Okay. Sit down. I'm going to lift your shirt so I can look at your chest. Okay. Keep your back straight. So I'm going to palpate his spine. The spine, do you feel any pain?
No.
The spine is straight in the middle. There is no abnormal curvature of the spine. Okay? I'm going to check his costal vertebra. Any pain?
No.
Any pain?
No.
The next I'm going to do is to check for thoracic expansion. Oh, thoracic expansion. Okay. Okay, breathe in. Breathe in. Out. Breathe in. Out. Good. He has good thoracic expansion. I'm going to check for tactile perimeter. Say 99.
99.
Say 99.
99.
Say 99.
99.
I'm going to percuss his entire lungs for posterior lungs for resonance. Good resonance. Good resonance. Good resonance. The next thing I'm going to check is diaphragmatic excursion. So I need you to keep your back straight, please. I need you to take a deep breath and hold it. I'm going to percuss from area of resonance to area of dullness. Okay. I'm going to percuss from area of dullness to area of resonance. Okay. You know what? Take a deep breath, blow it out, and hold your breath. Good. Okay. I'm going to do the same on this side. Take a deep breath and hold it. I'm going to percuss from area of resonance to area of dullness. Okay. Take a deep breath, blow it out, and hold your breath. I'm going to percuss from area of dullness to resonance. Okay. And then I'm going to measure. His diaphragmatic excursion is 4 cm bilaterally. Next, I'm going to listen to the breath sounds, long sounds. Okay. Take a breath out. Take a breath out. Keep taking take a deep breath out. I don't need to take a deep breath and you let it out, okay? Take a deep breath. Good. Take a deep breath. Take a deep breath. Good. So can you turn around? Okay, I'm going to palpate for tactile firmities. Say 99.
99.
Say 99.
99.
Say 99.
99.
Good. I'm going to listen to your long sounds in the front, okay? Okay. Okay. Take a deep breath. 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 Good. So on inspection, the chest rises with respiration. The patient's respiration is about 14 breaths per minute. And I had breath sounds in all areas of the lungs bilaterally. There is no wheezing, no abnormal lung sound, no adventitious lung sound. Next thing I'm going to look, I'm going to palpate for the point of maximal impulse. So the PMI is at the 5th intercostal space, and I'm going to palpate for heart rate. So apical impulse is 82 per minute, and it's full and strong. The next, I'm going to, with the bell and the diaphragm, I'm going to listen to heart beats on the 4 points, okay? So I'm doing the aortic area, which is the 2nd intercostal space on the right sternal border. I'm moving to pulmonic area, which is 2nd intercostal space on the left sternal border. And our EPS point, which is the 3rd intercostal space on the sternal border. And the tricuspid, which is the 4th intercostal space. And then finally, the mitral, which is the 5th intercostal space on the left sternal border. So I had S1, S2. I didn't hear any galloping, any friction, rock, or any other abnormal heart sound. So I'm going to take the patient up to the table for the rest of the examination. Okay, here. So while patient is on the table, I'm going to check the, can you raise your head a little bit? So I've measured the jugular vein. So on inspection, the abdomen is flat, there is no rash, there is no scar, there is no protuberance or any other abnormality or any visible marks. I'm going to listen to the bowel sounds on all 4 quadrants. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. The patient has normal active bowel sound in all 4 quadrants. Next, I'm going to listen to for the aortic, the renal, the iliac, and femoral for growth. Okay. The aorta, no growth. Right renal, no growth. Left renal, no growth. Right iliac, no growth. Left iliac, no growth. Left femoral, no growth. Right left femoral, no growth. The next I'm going to do is I'm going to percuss for the liver. I'm percussing for the liver. So I percuss from area of resonance to dullness, and I'll mark. And I'll percuss from area of dullness to resonance. Okay. And I'm going to measure. Patient's liver is 6 cm, and I'm going to percuss for the spleen. Resonance over the spleen. I'm going to palpate the abdomen lightly. Any pain or tenderness? No. Good. I'm going to do deep palpation of the abdomen. Any pain? No. Okay. I'm going to palpate the liver border. The liver border is 1 cm on the right costal margin. And I'm going to palpate for the spine. The spine is not palpable. I'm going to palpate for the kidney, right kidney first. I'm going to palpate for the left kidney. There is no kidney. Emeka, I need you to stand up. Sit on the edge of the table. So I'm going to inspect his lower extremity. The skin is warm. There's no signs of scarring or pain. Do you have any pain? No. There's no swelling on the joints. There's no swelling on the joint. Just by looking, patient has equal muscle tone on both legs. And I'm going to palpate the popliteal pulse. The popliteal pulse is strong, 2+. I'm going to palpate the posttibial pulses. 2+, strong and equal bilaterally. And I'm going to check for capillary refill. Thank you. Good, smart, patient. So the capillary refill is less than 3 seconds. So here, squeeze my hands. No. Pull it up. Great muscle strength in the upper extremity. Now, don't let me move your hand in. Don't let me move it out. Good. I'm going to check for sensation. Close your eyes and tell me what you feel. Cotton. Good. Sharp and dull. Sharp. Okay. Sharp. Sharp. Cotton. Sharp needle. Sharp needle. Cotton. Sharp needle. Good. The patient was able to identify sensation. So I'm going to check the reflexes. So I'll start with this. I'm sorry. I'll do the same on this side. Good. Good reflexes. I'm going to try your brachial reflexes. Good. I'm going to try your brachial reflex. I'm going to try your ulnar reflexes. Good. I'm going to try your patellar reflex. Good. Good reflex. I'm going to try this. The patellar reflex. Good. I'm going to try your Achilles reflex. Good. Okay, I need you to stand up. We're going to do the range of motion for your number. Okay, I need you to move to this side, up, move to this side, up, twist, twist, here. Good. Patient has good range of motion for the number. I need you to bend your knees. Good. Patients, we need to do some more coordination for nerve assessment. So stand here. I need you to touch your nose and touch my finger. Touch your nose. Okay, follow my finger faster. Touch your nose first and touch my finger. Touch your nose and touch my finger. Wherever my finger goes, touch your nose. Faster. Touch your nose, touch my finger. Okay, touch your nose, my finger. Touch your nose. Touch your nose. Touch your nose. Touch your nose. Good. I need you to do rapid alternating hand movement. I need you to do this. Do it as fast as you can. Good. We're going to do the rumba sign. I need you to stand up like this. Close your eyes first. Put your head backwards. Close your eyes. Emeka, can you be serious? This is an exam. Close your eyes. Put your hands out. Put your head backwards. Good. I need you to do heel to chin coordination. This. Move it as fast as you can. Good. On this side, move it as fast as you can. Good. The next thing I want you to do is to do the walking. Can you walk normal on your leg? Okay. Back, back. We have 32. Okay. Can you walk on tiptoes? Can you walk back like this? Okay, good. Easy. Can you walk like this? 1 foot at a time. Okay. The next I'm going to do, I need you to be on the here. Lie down. So during the abdominal exam, we omitted some tests for appendicitis. Make us scoot down, please. So we're going to do the psoas test. Can you move this leg up? Do you feel any pain here? No. Good. Now I'm going to flex your knee like this. Okay. Don't resist my movement, okay? Do you feel any pain on your abdomen? No. Good. That's the psoas test. Put your feet down. And I'm going to do the Murphy's test. Breathe in. Out. Any pain? No. So this is to test for kidney, for appendicitis and for kidney infection or kidney pain. Then we're going to do some couple of knee exam. So first of all, I'm going to do the drawer test. Emeka, put your feet here. Do you feel any pain or tenderness? No. Good. Put your feet down. Okay. I'm going to do the valgus and I forgot. I'm going to do the valgus and what? Valgus and varus test. Thank you. So Emeka, here. Okay. Here. Right. Yeah. So for the valgus, okay. There's no popping sound. And for the varus, there's no popping sound, so the meniscus is intact. Another test I'm going to do is the McMorris test. So any pain? No. Okay. Okay. Any pain? No. Good. What other tests do we have to do up here? Okay, I need you to come down. I think the rest we can do here. Okay, we're going to do some arm tests. Okay, can you put your arm like this? Stretch. Okay, turn it down. Don't let me push it down. This is the drop arm test. Let's do it on this same arm. Bring it, turn it upside down, straight. Don't let me push it down. Good. We're going to do some range of motion for the, I think, the shoulder. Okay. We're going to God. Okay, let's do the pitinal test. Stretch out your arm. Do you feel any tingling? No. Good. The other arm. Any tingling? No. Good. Can you bring your arms like this to your chest? No, stretch it out like this. Okay, straight like this. Straight. Bring it a little down. Stretch your chest, not like this. Good. Put your hands together. Put your hands together like this. Keep it straight. So this also tests for carpal tunnel syndrome and is negative. And the next thing we're going to do is the apprehension test. Oh, I remember what I forgot, the Apley test for the shoulder, range of motion for the shoulder. Can you do like this? And try to hold the other hand, turn your back, let's see. Full internal and external rotation on the right side. Try this one. Emeka, not that way, the same way you did the other one. Emeka, watch me, do like this. Try to touch both hands. No, I'm not crossing my hand, I'm putting it right on my back. Emeka, I'm putting it on my back. Good. Good internal and external rotation on both shoulders. Okay. What else are we missing? We did the Apley scratch test. We did the empty cam. Okay, the drop arm test. Okay, good. So, stretch out your arm. No, one at a time. Stretch out your arm. Stretch out your arm. Okay, hold on. Okay, can you drop your arm gradually? Good. Let's do it on this side. Put out your arm like this. Okay, can you drop it gradually? We did the drop arm test and apprehension test. Okay, so put your hand up like this. I'm going to move it backwards. Look at my face. I need to see your facial expression. Any pain? No. Good. Bring this arm up. I'm going to move it backwards. Any pain? No. I think that concludes our physical and health assessment, and thank you for watching.